Imagine that your grandparents, who are in their 60s, have a surgical procedure like a hip replacement, which is safe and usually done in a hospital. But during the recovery, they encounter Clostridium difficile that is known to cause deadly diarrhea, which can lead to death 30 days after initial diagnosis. Important facts about C. diff infections or CDIs is that it is a serious hospital-associated infection that adversely affects patients who are 60 years or older, has caused 29,000 patient deaths, and important risk factors for CDIs are one's exposure to antibiotics, the improper hygiene behaviors of their healthcare providers, and the patient's age. Measures like proper prescription of antibiotics and strict adherence to sanitation policies that are currently being practiced in New York State has shown effectiveness in combating the increasing trend of death due to CDIs. By looking at the figure here, we can see that the blue box, which corresponds to the plateauing trend of deaths due to CDIs in New York, proves that their antibiotic stewardship program and their strict adherence to sanitation policies has shown effectiveness in decreasing deaths due to CDI in New York State. Comparing New York State with the United States, we can see that the United States is still increasing, which means that we should be considering if funding should be increased for antibiotic stewardship programs and the promotion of strict sanitation guidelines in all healthcare facilities and hospitals in the United States. This brings us to the question that how can we reduce deaths due to CDI? As mentioned earlier, the important risk factors for CDIs is exposure to antibiotics and proper hygiene guidelines. So by increasing antibiotic stewardship programs and hand hygiene guidelines funding, we can ensure that we will have a decreasing trend deaths due to CDIs by moving more funding for this endeavor. Thank you.